Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about making a knee pain or knee flare-up plan. And what exactly is this and what does it look like? Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, the rehab and the recovery, frequently asked questions, and much, much more. So when you have a knee replacement, or even before when you're dealing with chronic knee pain or knee arthritis or any type of debilitating knee pain, you're going to have episodes of flare-ups of symptoms. So pain, stiffness, swelling, all those things we wish we could completely 100% get rid of them after having a knee replacement, but unfortunately that's just not the reality for a lot of folks and most folks, is that even though you'll feel a lot better for most people and you'll be a lot more mobile and be able to tolerate things, you're still going to have some periods and some episodes of flare-ups of symptoms. And so the thing to know about this is have a plan for when this occurs so that we can manage it effectively. Now, on top of that, I'll say be sure to make sure you focus on some empowerment, some self-efficacy, some reassurance. Understand that these flare-ups don't necessarily mean that something harmful happened or something is wrong with your knee replacement. You know, if you have certain red flags or you're concerned, of course, don't hesitate to reach out to your doctor or healthcare provider. But in most instances, a flare-up of symptoms is maybe we just did a little too much one day. Maybe we did a little too much walking or a little bit too much activity, or maybe it just might be for some reason that you completely don't really know. But flare-ups can happen, and we can manage it effectively. So when you have a plan, make sure that you are going to write that down. Write down a list of what you're going to do, what you need, and just what is the plan. So helpful items, things that you might need to manage the pain. If that's some sort of anti-inflammatory medication or some other medication, if that's using heat or ice or certain massage techniques or stretches or exercises or activities that you know in the past have kind of helped to calm things down and helped to make you feel better and kind of get over a flare-up of pain and symptoms. You want to think about other techniques for managing that pain and discomfort. So I think about mindfulness type strategies. So maybe that looks different for each individual. So it might be meditation, it might be deep breathing, but it might just be reading a book or listening to music or watching a movie that you enjoy. So find those techniques to kind of be mindful, to kind of calm down, to de-stress the body and the system. When we have flare-ups, when we have pain, it's not necessarily one factor or one cause. So the emotional, psychological, stress management aspect is something that's very important and shouldn't be overlooked. Think about having a support system, if that's family or friends that you can reach out to and talk to and just kind of chat with and tell them about what you're experiencing and maybe vent a little bit to them. Or maybe it's touching base with your physical therapist or some other health provider and saying, hey, I'm having this flare-up, I'm going to do this, this, and this to help manage it. Is there anything else that I should keep in mind or anything else that you would recommend? And I'm sure your physical therapist or other provider would be very happy to help you and give you a couple tips and pointers. And just think about taking it easy a little bit. It's okay to rest. We don't want you resting and being bedbound for multiple days on end, but take a little break, do a little bit less than you normally would, give yourself a day or a couple days, and then slowly get back into your normal activity or normal routine as you start to feel better, as your knee starts to feel better, and as that flare-up starts to subside, hopefully. So all that together, have a plan, have that toolkit of any equipment, anything that you might need to help you out along the way, if that's an ice machine, if that's certain exercise equipment, whatever that may be, and just have confidence and have reassurance that flare-ups are normal, they happen, and it doesn't necessarily mean that there's anything wrong, there's any damage, or there's any harm to the knee. It just might mean that your body's being a little extra protective, your nervous system's being a little extra protective, and it's going to take a day or a few days to kind of work your way through it and get back to your normal activities and your normal routine. I hope you found this video useful and helpful. Be sure to hit that subscribe button if you don't already so you can catch all of our latest videos. Be sure to leave your comments, your questions below. I love to hear from you, and I always try my best to get back to every comment I see. And again, be sure to hit that like button to help spread this video out to other viewers. Thank you very much for watching.